All right, so you're about to start your physiotherapy internship. You're going to want to listen up, because this is your essential survival guide. We're breaking down all the unwritten rules, the stuff you won't find in a textbook, based on what senior physios have learned the hard way. Let's get right into it.
And believe me, that's not an exaggeration. This quote pretty much sums up why we're doing this. Following these tips isn't just about being a good student. It's about navigating the real hospital world smoothly and starting your career off on the absolute right foot.
Exactly. Look, university is great for teaching you the what of physiotherapy. But this is all about the how you operate safely, professionally, and effectively in a crazy, fast-paced hospital setting.
Okay, first things first, we've got to talk about infection control. And this isn't just some boring rulebook stuff. This is the absolute foundation of everything you do. It's a huge responsibility to your patients, to your colleagues, and of course, to yourself.
Okay, rule number 1, and it's a big one. Never, ever touch a patient's file with the same gloves you just used on them. Think about it. You're basically transferring everything from the patient to a file that everyone else touches. It's a massive hygiene no-no, and trust me, a senior will spot it from a mile away and call you out on it, right there on the spot.
So what's the right way to do it? It's super simple, and you just need to drill this into your head. 1. Finish with your patient. Gloves come off. 2. Sanitize your hands. 3. Then you can grab the file. Just get that into your muscle memory. It's non-negotiable. Now, you've got to be extra careful in some places, right? Think geriatric wards. They're high-risk zones. I've heard stories of interns catching fevers after they're posting there, all because they got a little too comfortable. So even if you see someone else slacking, you don't. Your health is just as important.
All right, this next one might seem kind of minor, but it's a huge tell. Every hospital has a color-coded system for waste disposal. Taking the time to learn it shows you're paying attention to the details, that you're a professional who cares about infection control from start to finish.
Okay, let's switch gears a bit and talk about patient interaction. These are the little things you do at the bedside that make a huge difference. They build trust, they show respect, and they scream competence.
This needs to become an instinct. Before you even approach a patient's bed, the very first thing you do is check the bed railing. If you see a warning sign or a caution chart, that's critical information. It means the patient is infectious, and you need to change your game plan immediately.
And if you see that sign, there's no thinking about it. You just do this. Double up your protection. That means a double mask and double gloves. No questions asked. Remember, you can't take care of your patients if you don't protect yourself first.
Here's another one to burn into your brain. It's really simple, but you have to know it. A little orange dot sticker on an inpatient file, that means the patient is a confirmed HIV case. Again, this is there for your awareness and your protection.
And this is so important to remember. Seeing these signs isn't about being scared, it's about being aware. It's about being a smart, informed clinician who knows how to take the right precautions for everyone's safety.
Oh man, this is such a classic intern mistake, and it's an easy one to make. It might feel more relaxed to just plop down on the edge of the patient's bed, but it's a major don't. That bed is their personal space, their clean zone. Sitting on it just screams unprofessional and, it's not hygienic. The fix? Super simple. Just grab a stool if you need to be down at their level for a bit. Otherwise, just stand. It maintains that professional boundary and shows respect for the patient's space. Okay, another big one. Think before you act. Imagine this. You cheerfully ask a patient to stand up, and then you realize they're still hooked up to an IV line or have a catheter in. It's not just unsafe for them. It makes you look totally careless to the patient and the nursing staff. So what's the pro tip? You do a full visual scan every single time. Look for any and all tubes and lines. Double check with the nurse if you have to. Confirm they are totally clear to move before you even start. This simple check saves you from chaos and shows everyone you know what you're doing.
All right, we're on to our last section. We've talked safety, now let's talk about professionalism and accountability. These are the habits that go beyond the bedside and help you earn your spot as a respected member of the healthcare team.
Look, the nurses are your best friends on the ward, but you can't just be passive and wait for them to hand you a list of patients. Especially in a fast-paced ward like orthopedics, patients are coming and going constantly. If you just wait to be told who to see, you're going to miss people. And guess what? That's on you.
So you've got to be proactive. This is all about taking ownership of your patients. Get into the habit every single morning of going through the files yourself. You are responsible for finding your physiotherapy references. It's your caseload. Own it.
And listen, if it's not written down, it didn't happen. You have to document everything. Write clear notes about your treatment, the dosage, everything, in both the main doctor sheet and the physio assessment sheet. This is especially critical in neuro wards. Good notes equal good accountability.
You also have to know how to read the room, right? Your approach has to change depending on where you are. On ortho rounds, when the top surgeon asks a question and you don't know the answer, it's way better to just be quiet than to throw out a wrong guess. But in the ICU, it's all about your actions. You just have to do your job and do it well, clearing secretions, watching vitals, because people are always watching and the stakes are incredibly high.
So what does this all boil down to? How do you actually earn that respect? It's pretty simple, really. Show up on time. Every time. Watch your seniors like a hawk. Be a sponge. Absorb everything quietly. And always, always stay alert and engaged. That's the formula.
So yeah, we've gone through a whole list of don'ts, but really, this isn't just about avoiding getting yelled at. This is about building a strong, professional foundation so you can go from just getting by to actually excelling in your internship. And that's really what I want to leave you with. Following all these little rules will definitely help you survive. They'll make you a competent, safe intern. But the real question is, what will you do to go beyond that? What habits are you going to build to become an exceptional physiotherapist? That's where the real journey begins.